Wellness for another Wind Down Wednesday. It's Halloween. It's a Halloween version.
Yep.
Because we're talking about Botox today. So yeah, so it's going to be fun. We're going to be talking about uses of Botox, and I'm going to use Botox sort of loosely, any of the neuromodulators, and we'll talk about what brands are available and what brands are coming up on the horizon. So without further ado, Janet, welcome to Wind Down Wednesday, and thank you for getting us this wine. We even got Halloween-themed wine.
Yes, yes, yes. We're talking about 19 Crimes. Don't know if you guys have heard about it. They have a bunch of different labels, and it's actually a really fun group, whoever thought of this concept. It's called 19 Crimes. We're drinking the Warden today, and the Warden is a red blend, so it's got blackberries. It tastes like blueberries to me, but I'm probably wrong. It's got blackberry, it's got boysenberry, it's got mocha, it's got vanilla. So no wonder I like it. It's like
delicious.
Dessert. But it's really not a sweet wine. It's just a really nice red berry wine. The fun thing about 19 Crimes is that it's all based around the 1700s, 1800s, where British rulers, instead of punishing criminals and sentencing them to death, they actually did punishment by transportation. And they transported these criminals, men and women, who had committed either one or more of these 19 crimes that they had listed. They basically transported them to Australia. And these criminals ended up, colonizing there, if you will. And on the bottle, each label has an actual criminal. This one actually that we're drinking has the Warden on there, which is a lot of fun. The cork, if there's a criminal on here, when you uncork the wine, it tells you what crime they actually committed to get this punishment. And just kind of a couple of fun little different crimes that we have here. We have setting fire to Underwood, stealing from furnished lodgings, impersonating an Egyptian.
That's my favorite.
Yeah, love that one. Watermen carrying too many passengers on the River Thames, if any of them drowned. Things like that. So it's a lot of fun. There's also a really cool app that you can get to go with this wine, so I put it on my phone. And if you scan the label of the wine bottle like this, you can hear it. Let's try this again.
It talks to you.
Up against the wall.
So that's the Warden talking and slamming the door on your face. But the other ones have prisoners on them, and they actually, animate and come to life. So it's a lot of fun. You can pick this wine up at Bevmo. You can pick it up at Fry's, Total Wine and More, your favorite wine place. They vary in price from $12.99 to $19.99. So I think it's a good, fun bottle of wine there.
I think it's great, and it's perfect for Halloween.
Yeah, exactly.
Which is my favorite holiday.
Oh yeah, that's right.
Even
Fun fact.
Halloween.
She has the ombre look.
The ombre blood look. Yes.
I also wanted to tell everybody about the October savings because we have a lot going on with that. We have received $50 off each syringe of Restylane Kiss, which is great for the lips, by the way. If you like soft, plump, kissable lips, not fake looking lips, $50 off. And then you can also get $40 off any Jeuveau treatment if you haven't had one in the last 90 days. And Jeuveau is one of the toxins that we'll be talking about today.
Yep.
So it's the
new
modern
newest
tox.
one. Yes.
Yeah. And then another one, you can get a free PRP upgrade for spookingly beautiful skin. And that's for any RF microneedling or microneedling treatment. Spots are limited, so you'll want to call the girls and get booked in Christine or Amanda's schedule. And then 30% off any Definage product when you buy the new Definage Power Trio Pro, which has even more defensins in it to help your skin create brand new baby skin cells. So we have the new Power Trio Pro in the office. You can save 30% off any of the other pieces that you buy.
And that one's only you can only get that from doctor's offices, like select doctor's offices like ours.
Right.
And if you don't know that the Definage system is my absolute favorite.
Mhm.
Yes, so
That's another fun fact for the day.
that's right.
Another one is don't diet, downsize. Downsizing in Paradise costs $12.50. It's normally $1,400 for the program. So, and then, yeah, that's from the wellness team, as well as BioT Serene supplements for stress and anxiety. If you're still having to deal with that, I know things can be still stressful from COVID and whatnot right now, 20% off. Our next Wind Down Wednesday is going to be November 10th, and it's going to be a surprise. So mark your calendars for Wednesday, November 10th, 4 p.m. Some other fun things that are coming up in the near future here. Tuesday, October 26th at 6 p.m. at Norterra Family Medicine. We're going to have another BioT, bioidentical hormone seminar for men and women. So if you've been wondering if bioidentical hormones are right for you, it's a free seminar. Just call us and reserve a spot. You can call us here at Paradise, or you can actually call Norterra Family Medicine and reserve a seat. Boy, I've got a lot to share.
You have a lot
today.
to say today,
I know,
Janet.
my
I'm just going to
goodness.
sit back and drink my wine.
You should. I need like a bottle of water
Well,
too.
we started early today because I knew how much Janet was going to talk.
The other thing I wanted to tell you guys about, and this goes great with our Botox subject here, is the biggest event of 2021 for Allergan and anybody who's a cosmetic injector is National Botox Cosmetic Day is on November 17th. It's a Wednesday. But this year we're celebrating it all week long from the 15th, 16th, 17th, 18th to the 19th. We're celebrating. On the 15th of November, we will be offering Botox at a discounted rate, so make sure you call and schedule your appointment. On the 17th, Allergan is actually going to be offering specially priced gift certificates. We don't know the details yet, but let's just say that 2 years ago, their system got totally crashed because so many people were trying to take advantage of this offer. So you need to be signed up for the ALLE program. That's ALLE. If you're not, you'll want to be, because they do give credit for any Allergan treatments like Botox, Juvederm, Voluma, Volbella, Latisse. They also give credit for other treatments that you do in our office that are not Allergan related.
We learned, sorry to interrupt you,
Yeah.
they actually give credit for Dysport
Yeah.
and for Restylane.
Yeah.
So you can earn credit with ALLE. I think part of this, let's face it, is their way of figuring out like who's doing what.
Mm-hmm.
But they're going to give you credit in the amount of about $5 off of future treatments for every time you do even hydrofacial.
Mm-hmm.
You can earn ALLE points.
Yeah, absolutely. Yeah, it's their way of finding out what consumers are liking, what they're asking for, what they're doing. But then what they're doing is they're thanking you by giving you credit that you can use towards your future Botox or filler treatment. So whether you're already a Botox or a filler user, or you've been kind of thinking about it, they're going to incentivize you to say, hey, try our products. Here's some free money. So we're happy to participate.
Yep.
So that's really exciting. You'll want to call the office because there are only limited appointments available. November 15th, we've got special rates going. And then on the 17th, you want to be on the lookout. Mark your calendar to be able to purchase one or more of those certificates. Like I said, we don't know what the offer is yet, but they're always very
But
generous.
we're pretty sure it's going to be a BOGO.
Yeah.
It usually is.
Yeah, and if you have no idea what I'm talking about and you
Call
don't
us.
know what ALLE is, give us a call. We'll talk you through it. We'll send you a link so that way you can start earning points right away and get some free money in your wallet. I like that.
I listen, any way we can help patients to cut costs on the things that they want to have done. I mean, these are luxury items, let's face it.
Mm-hmm.
And so if we can help you to save money, you know, for those of you who don't know, every dollar you spend here in Paradise, you also earn Paradise points.
Right.
And those will add up to coupons that you can use towards future services. And then anytime the manufacturers offer these deals, we will help to enroll you so that you can be privy to all of those discounts. So any questions about that, let us know.
Yeah. Front desk girls are really well versed and they're glad to help.
Yeah, I was so excited about that, Al. I mean, I kind of knew they were doing that, but I don't think I understood really the scope of
Right.
the things that even other skincare products, Skin Better
Right.
Science, for
Mhm.
example. You buy Skin Better Science, you can earn ALLE points. So, so if you are enrolled in Ally, make sure just to mention that upon checkout, so that if there's any applicable items in your shopping cart, we can apply those credits when they're due.
Yeah, and they do have a free app that you can have on your phone, so you always know how many points available you have. You know what coupons. They send me coupons on my birthday.
Yeah.
So hey,
It's free money. You should take it. Take advantage.
Yeah.
Okay.
So that's what's going on.
Botox, baby.
I know. Let's talk about it.
Yeah, let's talk about it. So, okay. So just by way of, recapping or starting with the basics for those who aren't familiar with neurotoxins, there are 4 currently available neurotoxins on the market that most people, it's sort of like Kleenex and Puffs. Most people just refer to that all of them as Botox, but there's actually 4 different brands on the market. There's Botox Cosmetic, which has been around the longest. Then there is Jeuveau, which has been around, that's the newest, so that's the new tox. And then there is Xeomin and Dysport.
Yeah.
So Dysport came after Botox, and then Xeomin hit the market, and then Jeuveau. So these are all FDA-approved neuromodulators. We call them either neuromodulators or neurotoxins. These work on dynamic wrinkles. So we are talking about wrinkles that are created by our facial expressions or by muscle action. And some of the off-label uses, and even on-label uses, but mostly off-label uses are not even for wrinkles per se, right? So for example, Botox is FDA approved for hyperhidrosis or sweating in axillary hyperhidrosis, so under the arms, but also hyperhidrosis of the palms and soles. So, so neuromodulators, and pretty much if one works and has gotten, they're all at the core, they have the same active ingredient. So while they're all a little bit different in terms of their manufacturing process, where they're manufactured, maybe just how they're manufactured, at the core of each of these products is the same active ingredient.
Right.
So they're really all doing the same thing. Patients will have a preference for one versus the other sometimes. Some patients feel like they're all the same. They are all FDA approved to last about 3 to 4 months. Many of them have gone head to head with each other and have shown that they're about the same in terms of their ability to stop wrinkles and last about the same amount of time. So the choice of which to choose is somewhat dependent on who's giving the best deal, right?
Yeah.
Which manufacturer is going to give you the best deal. If you've tried one and for whatever reason you didn't have as long of a result you wanted, and we can talk about different factors that affect that, or if you've been using the same product for a long time, I think it's a good idea every now and then to change it up because, what makes these different is the protein coating around the product. And sometimes when your body sees those chemicals all the time, and I don't mean chemicals in a bad way, but just those proteins, it learns how to adapt and detoxify against it. Like
Kind
any
of like a medication, right?
It's like any medication you take. So the longer you take it, your body can build a tolerance to it to some extent, and learn how to detoxify. So it may not last as long. So I like to advise my patients every now and then, if say for example you've been a habitual Botox user and maybe your Botox isn't lasting as long with the same dose, maybe it's time to switch it up to Jeuveau or Dysport. Now in our practice, we don't routinely carry Xeomin, though we had in the past, and I don't find anything is wrong about Xeomin. Xeomin is the only one that actually doesn't have a protein coating on it at all. It's just sort of a naked active ingredient. That can come in handy, that property can come in handy for some patients who have developed resistance to some of the other neuromodulators. So sometimes we will special order Xeomin for those patients. So we happen to have a little bit of that on hand today. But I like them all. As far as my recommendation of which to choose, it's based on a conversation that I'll have with you at the time of your treatment or your consultation. I have my personal favorites. Like for my face, I actually like Dysport because I have very dynamic forehead. And I find in patients who, and I'm due for my treatment, so I'll be really good at showing you expressions. So in patients who have very dynamic foreheads, the way that Dysport, so they all come as a powder. Some of them are freeze-dried, some of them aren't, but they're all a powder upon arrival that we have to reconstitute with saline. And so in all of my products, now this is off-label, on-label would be 2.5 mLs of solution in each one of these. I use 2 mLs. I just think it's better. It's my sweet spot for me. So I use 2 mLs to reconstitute my product. You have to put, people ask sometimes, like, is your Botox diluted? Like, what does that even mean?
It always
is diluted to some extent, right? But because you have to put saline in it. But with Dysport, it's the only one that's dosed a little bit differently. So Dysport, I use 3 times as many units as I do of the other 3 products. So so that's the only one that's a little bit different. And maybe it's because I use 3 to 1 that it, for me, I think lasts a little bit longer. But again, this is nuance. Like,
right.
It's not like it lasts 6 months longer.
Right.
It might last a week or so longer than the other products. And because, again, in the same amount of solution, I have 3 times as many units, I think it has just a little more ability to spread within the droplet of solution. And so for a forehead like mine, I've got sort of I have 5 head. I have a big forehead with lots of wrinkles. And I don't want it, I want it to just diffuse evenly across a large surface area without it leaving pockets that haven't been treated. So I don't want like a brow to go crazy or even get too heavy. So I think Dysport works nicely for those patients. That's the one area where, if that's your trouble spot, I think sometimes going with Dysport is a better choice.
That works for me too. And I use a combination, not that they're mixed together, but Dysport in, the upper area, and then use Botox like around my crow's feet and stuff like that.
So, we can play around with it to figure out what works best for each patient. So that's the beauty of it. And like I said, some patients don't notice any difference, and then it's just sort of based on who's given the best deal. So I wanted to sort of review, because I think a lot of people don't realize all the different uses of these neuromodulators. And really, you can use, even if, say, for example, Botox has its FDA approval for crow's feet, and maybe Jeuveau doesn't.
Right.
You can use any of them in any of these areas. So I'm just going to talk in generic terms, because honestly, you can pick any of these. They're all going to do the same thing. They all have the same active ingredient.
It's just all about how they went about getting their FDA approval,
right? They just went through the process, and some of them didn't.
Yeah, and it costs so much money.
And time.
Time and money to be able to get these FDA approvals. So that's why certain companies they'll go for one area.
Yep.
And then providers like you can use it off label. We
can play around with it, and it's really then up to the comfort level of the injector, and you know that it's safe in terms of standard dosing. So the one thing also that makes Jeuveau a little different than some of these others is Jeuveau is the only one that doesn't have a medical indication.
Right.
So Jeuveau is purely indicated for cosmetic use, where the others have medical indications. So for example, and I won't get into this too much because I don't use it for these reasons, but Botox is FDA approved for bladder spasm, and it can also be used like esophageal spasm. I think that's off label, but it is on label for bladder spasm. It's on label for certain muscle contractures in larger muscle groups. But it's also, and many of you may know, is FDA approved for migraine headaches. And like we said, it's also FDA approved for sweating. So those are medical indications. And as we go through these different areas that can be treated, I'll also mention standard dosing. Because I think that's also, an interesting point to bring up. The more we use these products, the more we realize that dose and duration go hand in hand.
Right.
So you can achieve, with high dosing, you can achieve longer lasting results, and without looking fake, without really even affecting the cosmetic result.
Right.
So I think the cosmetic result you get from your Botox has more to do with where it's injected than how much.
Yeah, and that's why it's important who you go to.
Yep.
Right?
Totally agree. And if you are going to go with high dose neuromodulator, which is a thing now,
Mm-hmm.
you also make it more concentrated. So instead of using 2 mLs, maybe I would use 1.
Okay.
So I'd make it more concentrated, use a higher dosage to get the same cosmetic effect as I did with the lower doses, but to have that effect last longer. And in part, we're playing around with that more because there is a new neuromodulator coming on the market, which there isn't a name for it yet because it hasn't been FDA approved, but we injectors, physicians, nurses, we call it DAXI because each one of these has a name. Like this is botulinum toxin, and this is probotulinum toxin, and onobotulinum toxin, etc. So they all have these weird like prefixes on their name, and the DAXI is deoxybotulinum toxin.
Okay.
So right now we generically call it DAXI, and DAXI requires twice as many units and lasts 5 to 6 months. So as opposed to 3 to 4 months with the currently available neuromodulators. This one is a longer lasting product, but it does require twice the dosing. So there's that. So I think a lot of these manufacturers and we as providers kind of questioned, well, wait a minute, what if we just doubled the dose of what we currently have? Would it work just as well?
Right.
I don't know, I've played around with that a little bit and I haven't found that to be the case, but I've also chosen patients who I think have developed a little bit of resistance.
Right.
Like they're coming in every 2 months because their Botox is wearing off so quickly. And we've tried all the different brands. It doesn't seem to matter what we use. And so I'm like, well, let's try doubling the dose. And it still doesn't work. So I think if you have a resistance, it's not really even going to matter so much what the dose is. It is what it is. Okay, so I'm going to start from the top. I figured it would be easier for my brain. So, okay. So one area you can use neuromodulator, and I'm just going to use Botox sort of as a generic term, but again, that I'm referring to any of these products, is in the forehead. So for the horizontal forehead lines, when we raise our brows, we get these lines. This is actually a really challenging area to treat adequately. So the more I treat patients, the more I realize there's really these nuances about treatment on the forehead, and I have lightened my doses and kind of spread them out over larger areas to avoid those Spock brows. The frontalis muscle is what we're treating, which is what brings the brow up. So when you treat the mid-brow, which is what brings, I'll take my glasses off. So when you treat there's 2 like opposing muscle groups in the forehead. You've got your glabella, which pulls down and in, which is your angry face and your 11s. And then you've got your frontalis, which brings the brows up and creates these lines. Your lines always go opposite to the direction of the muscle action. So if my muscle is going like this, my lines are going to go like this, right? If my muscle is going in, my lines are going to go in like this.
Right.
So you never want to treat a forehead in isolation, because this is the muscle that brings the brow up. If I just treat this without treating the mid-brow, my brows have nowhere to go but down. So I'm going to look angry and sad like this.
And feel heavy too.
So I found that I like to lighten up my dosing and spread it more evenly across the forehead. On-label dosing for the forehead is, I want to say it's like 20 units. It's a high dose that they used for their clinical studies. Most of my patients are not using 20 units in their forehead, maybe 10 to 12 units. Men always need more than women. They're just larger build, so they have more surface area. Their muscles are a little stronger, so we need a little bit more product to overcome those muscle actions. So, you can usually, it's like a 1.5, multiplier with men. So I might be using 15 to 18 units on a man maybe 20 units, but usually not in a woman.
Okay.
And again, with Dysport, multiply that times 3, that's how many units we would use. So, mid-brow, that's the most common area. That's all of these have an on-label indication for the mid-brow or the glabellar lines. And again, that's the muscle that brings the brows down and in when you're angry, creates those 11s, and it's a depressor muscle of the brow. So when you inject that with neuromodulator, relax that depressor, it goes up. So you're going to get a lift to your brow. So that's why I like to treat those 2 together. So you're neither too heavy or too high. So you don't get those Spock brows. on label, 20 units is what's recommended for the mid-brow, and I would say that's pretty true. Some patients need 25. So that's actually an area I'm finding I'm using more.
Yeah.
I'm using less on the frontalis muscle. Crow's feet, orbicularis muscle is what we use when we squint. Brings kind of the eyes in and closes them in and tight. And so injecting laterally around the orbicularis muscle helps to open the eyes up, helps for those crow's feet lines. On label recommendation for that is 24 units.
Yeah, 12 and 12, right?
12 and 12. And that's why, Allergan likes to call them like a 64, that's 20, 20, 24.
Yeah.
Most of my patients are not getting that much, though maybe I'm underdosing. I mean, there's a lot of talk about maybe we're underdosing our patients and that's why their product isn't lasting as long. But I've found over the years that I've gotten nice results with maybe 20 units, 10 and 10.
Mm-hmm.
So not lowering it too much, but sometimes I need more if patients want me to come a little further down under their eye and they get those little creepy lines in here.
Yeah.
And that's when I'll use 24 units. The nasalis, the bunny lines.
Bunny lines.
Yep. So interesting point about bunny lines. When we close our eyes really tight, we tend to squinch like this, and we create these bunny lines.
I
Now,
just had my treatment.
If you can't do that, but I can. So I'm so overdue. So I thought about even injecting myself on today's thing, but I'm like, I'm drinking wine. I probably shouldn't inject myself with Botox on air. So anyway, if you just treat your crow's feet and you never treat your bunnies will become more pronounced.
Do they kind of overcome? They overcompensate.
It's actually the same muscle that drapes all the way around your eyes. So if you knock out the ability over here, but then you're sending the signal to your brain to contract that muscle, this is where it's going to contract. So you can actually develop bunny lines if you continually treat here without ever treating your nasalis. So I always recommend treating that. Especially, I'll notice it in patients because I have you animate. Like that's how I figure out the best placement.
Mm-hmm.
It's not cookie cutter. I base my treatment decision and my location of injection based on your individual muscle locations, right? So treating the nasalis is important, and usually it's a couple units on each side, so maybe 4 to 6 units to treat the nasalis. Now, if you have very strong pull like this, and you pull up from down here, sometimes you actually, this little trick I learned actually from J.D. McCoy, is treating here, right here at the nasal ala, they call that little triangle area right at the corner of your nostrils, to relax this muscle so you can't pull it up and create that. So sometimes you have to treat both of those areas to really get a good effect on the bunny lines. The other reason to treat here is for gummy smile. So when people have a strong pull, there's a muscle that actually attaches here. It has a really long name, levator, nasi, something, and it pulls up here, and in some patients who that's very strong, when they smile, that's when you see more of their gum.
Right.
So, patients will come in saying, I don't like the way my smile looks or whatever. You can just put a couple of units on each side and it just softens that a little bit so they can't pull their lip up as much. So that's an area that you can
Never
treat.
knew that.
You see, you're learning something.
Yeah.
You can treat for the vertical lip lines, orbicularis oris, which is the circular muscle that goes around the mouth, to treat smoker's lines, those little kissy lines. So a couple of units here, a couple of units here. You don't want to overdo on the lip because then you're impacting function. It's such a mobile area of the face that if you overdo it, patients will say they couldn't suck from a straw or they were drooling when they were eating soup or whatever it is because they can't purse their lips as much. So I go very light there, and unfortunately because we have to go light so as to not affect function, it sometimes means that the treatment doesn't last as long.
Right.
So in any case, I do think that's a nice area to treat. And then the more popular thing that people are coming in now requesting is lip flip. The lip flip. And so I think, and not everyone agrees with me on this, but I think there's 2 different ways to treat a lip. You can treat the lip lines, and I go up a little higher here. if I'm doing a lip flip and my goal is just to evert the lip a little bit, I actually use 5 units and I'll do it right along the vermilion border. So right on the red border of your lip. 1, 2, 3, 4, 5 units.
Okay.
Just to evert the lip. So that's different than treating the lines.
Right.
So that's more for a young person coming in that just wants almost
They want a fuller
a
lip
little
look?
fuller
Is
lip
that what it
look.
is?
Yeah, they call that the lip flip. So that's one thing you can do. The other thing you can do is treat the DAOs. I'm treating this all the time. This is off label, but we have the DAO muscle, depressor anguli oris, which comes from the corner of the mouth down and makes, it's like your frown muscle. So it's this muscle. You see how I get these little lines here? So you can treat that on either side. It's usually about 2 to 4 units on either side. And it relaxes that, so you have a more neutral mouth. You don't look like
rather than
frowny all the
pinned down.
time. So I often will treat that, especially when patients come in complaining of marionette, or they just have that. You can see, I watch as I'm talking to patients when they come in. I mean, I'm chit-chatting because I like to chit-chat, but I'm actually watching patients animate as I'm talking to them. So sometimes I don't realize when they're just still what I need to recommend until they start talking, like, oh, I gotta treat your DAs, because you tend to make that facial expression. And Zoom has been very good for business for this reason, because I think people don't realize what they look like when they're talking until Zoom came around, and now they're looking at themselves. I mean, let's face it, when you're on Zoom, who are you looking at? You're looking at you when you're talking, you're not looking at everybody else. I mean, sometimes you do, but a lot of us hyper-focus on our own face. So they're seeing expressions that they're making that they never realized they made, and so that's bringing them in. So it's actually, thank you, COVID, for that. So anyway, you can treat the DAO muscle, very popular. The mentalis muscle, which is your chin muscle. It's a big round muscle that sits here. Oftentimes people will pull in. They get that peau d'orange, which is that orange peel look of their chin. It will soften that. I also use fillers to treat that more and more, so now that there's some on-label uses of dermal fillers for the chin. But Botox in the chin is something a treatment I perform all the time. So that, again, it helps that bumpy look, and if you tend to pull in here, it also creates some of the marionette. So I think relaxing that can help. The masseter muscle, big muscles that sit here on our jaw. These are clenching muscles. And like for myself, I'm a clencher. I clench at night. I don't even realize I'm doing it. I should be wearing my mouth guard, and I don't. But my dentist, my poor dentist, she's constantly having to fix my teeth. But I do treat my masseters. And you need a fairly hefty dose. I didn't mention, for the mentalis, usually it's about 5 units. For the masseters, I mean, you might be using 10 units each side, maybe 20 units each side.
I was going to say up to 40. Probably.
Yeah, so 20 units each side, you're talking about 40 units there. So it's a big muscle, but what I will say is once you get it to correct and not to pull as much, you don't need to do that every 3 to 4 months like you do for other cosmetic uses, maybe every 6 months.
Okay.
So, and one thing of note for the masseter muscle is in older patients with loose skin who have a hypertrophied masseter, it actually provides bulk back here and can almost pull your skin back so you look less jowly. You might look more square. I find that people who have strong masseters, their facial shape is more square or round. And so it is a popular treatment like in Asia where they tend to have rounder faces to slim that part of the face and make them look more angular, make them look more oval, which is a desirable shape to the face. Same thing with square. So people like the look of an oval face. So when you're looking at like attractive faces, those are the ones you usually point out, but sometimes you need that muscle bulk to pull your skin, and over treating the masseter, now you've lost that
you've relaxed it, right?
muscle, which is pulling your skin back. You relax it, and then you can form jowls. So I think in older patients, you have to be careful about not over treating the masseter muscle. Platysmal bands. So, and I'm a really good example.
I do those.
Yeah. So
mine are treated.
These are muscular bands. There's a muscle that sits, in your neck that connects to the base of your jaw, and you can develop these bands. So you can actually treat those bands. You just grab them, you put a couple units of of Botox or your neuromodulator of choice into each of those. There's something called the Nefertiti lift, which is a Greek goddess, and she had beautiful, like shadowing jaw, like snatched jawline, as they say.
Oh yeah.
So
That's the new lingo.
that's the new lingo. So it's treating the lateral platysmals here, because if you have a strong pull here, it almost makes it look like you've got, you don't have that shadow.
Like a thicker
Like a
neck.
thick-
Yeah.
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 So it gives you that.
That's why you
beautiful
treat mine.
female
Mine really
shadow.
come wide.
Yeah. So although I over-treated somebody's platysmal bands
Oh no.
recently, and she's like, I had a hard time doing sit-ups.
Oh.
Because she was like pulling, like, I mean, I guess she's using the wrong muscle if that's the case.
Right.
She
Yeah,
should be
'cause
using
you're
her
supposed to use your
abs and not
core.
her neck. But yeah, I thought that was funny. But I mean, she loved it. She loved the results because she had no platysmal bands. But
Right.
she's like, I had a little harder time doing my sit-ups. So anyway, so
That's
there's that.
interesting.
So depending on how many platysmal banding, how much platysmal banding you have, you can use anywhere from 15 to 60 units. I mean, it really kind of depends. The one thing you have to watch out for is not really over-treating because and going too deep, because it can affect the muscles of the larynx and other things that you need for survival.
But Botox is pretty superficial.
I actually just pinch the skin, pull it forward, so I'm not going into those deeper structures.
Yeah.
Okay, we touched on hyperhidrosis for sweating.
Migraines.
And migraines. So migraines, there's a whole protocol. It's 155 units of Botox. Most of the time when I'm treating patients for migraines, I'm using Botox because that's on label for that use. And we can occasionally, in most cases, get it covered by insurance.
So that's something that's usually done through the family practice. Though,
Yeah,
is that
because
right?
we have to put in prior authorizations for insurance and this and that. So
And then that's the Botox therapeutic.
yeah, we actually order a 200 unit vial specifically
Okay.
for the patient for this purpose. So, but the treatment protocol involves treating the temporal muscles, the occipital muscles, the cervical spine muscles, the trapezius, along with the glabella and the forehead. So it's obviously a little higher dose, though, I mean, really to put that into perspective, I treat myself with 100 units of Botox easily because I'm treating my masters, which can take quite a bit.
Right.
All the areas we just talked about, platysma,
Right.
it adds up. I mean, it's easily 100 units.
I'm easy 65, and I don't treat my masseters, but I'm easy 65 units.
Add your masseters, you'd be at 100 like me.
Yeah.
So, sweating in the armpit, typically you're using 50 units each side, so 100 units total. We do dilute our Botox in this. We reconstitute with 4 mLs of saline so that the product diffuses further in a wider area.
Right.
We can get a better effect that way,
Yeah.
affecting more of the sweat glands. Honestly, I've never treated hands and feet.
Right.
I think I
But
shy
you
away
can,
from it.
right?
You can absolutely do it, and it's the same dosage, so it's 50-50, 50-50. I haven't done it mostly because I haven't had patient demand, and I think it would really hurt.
Well, the skin's thicker, right?
I don't know. There's something about it. I think it would hurt. But it's not that I wouldn't treat it. I just haven't. In 14 years of injecting, it hasn't really.
I haven't
been a
had
thing.
anybody ask.
Yeah, it hasn't really been a thing. Though I have treated patients off-label on the forehead, like actually the scalp for sweating,
Yeah.
and it's worked there. Some people say my head just pours sweat like when I work out, and I can't stand it. It's like in my eyes. So we've actually treated scalps like behind the hairline, and it stopped the sweating there.
That's great.
Yeah. I think that's everywhere I can think of.
I know. Yeah.
I think it is.
Yeah.
I'm sure that there's other areas. I know. You can treat right here at the base of the nose to tip
Okay.
the corner of the nose up, because there's a muscle that pulls here.
Oh, that pulls down.
Yes. So you can
Interesting.
relax that and
I
bring
don't
your
need that.
nasal tip up a little bit. I think someone mentioned to me one time about treating earlobes or something we do that with filler,
Yeah.
but you can treat with Botox. I don't know how that works. I've never done that before.
I'm trying to think, why would someone want that? Like, do their earlobes wiggle or something?
I don't know. I mean, here's the thing. Botox is very safe. So while I think a lot of people shy away because, it's toxin. right?
Mhm.
Listen, Botox has been around a long time. We've used millions and millions and millions of units
Yeah.
in people, and the side effect profile is very minimal. So
Right.
speaking of which, what's the worst thing that's going to happen to you
Right.
with cosmetic use of Botox, right? The most common side effect is a headache, just from the
Right.
injections, right? And but although I think there might be a function of the medication itself, because some people get the headache every single time, usually lasts a week or two. Those patients still seem to come back for Botox, so the headache isn't so bad that they feel like they shouldn't, they don't want to come back.
They like the result.
They like the result.
Mm-hmm.
The side effect that you hear is somebody getting a ptosis,
Right.
where the product has diffused into an area where you don't want it. In this case, the upper eyelid. So when you treat here, there is a foramen, there is a hole here that nerves and blood vessels come out of. And it's hypothesized that perhaps when we're treating the glabella, that the medication can diffuse down through that foramen and into the eyelid.
Okay.
I also think it may just be a different way the muscle inserts in some patients.
Sure.
Here.
Everybody's a little
Everybody's
bit different.
a little bit different. And in 14 years of injecting, I had literally one ptosis.
Right.
And of course, it was the first time the patient had ever come to see me. So she thought I was the worst. And even though I told her, I'm like, oh my gosh, you're the only person that's ever happened. I'm sure she didn't believe me. So
It's temporary. That's the good
but
news.
it's temporary.
Right.
And there are actually some new medications, one called Upneek, that you can use that is once a day, you instill it into your eyes and it relaxes the mular muscle, which helps to pull the lids up.
Yes, you don't have that little sleepy eye, right?
I mean, you still might notice, people are so hyper acutely aware of how their face looks like. You can notice the difference of like a millimeter in your eyelid
Okay.
position. So the patient would still notice it maybe, but other people looking at them may not notice.
Right.
So, and it's temporary. So
Mhm.
it might last 6 weeks.
Right.
So that's the worst thing, you
Right.
know. There have been reported cases of flu-like illness after, I think it's based on maybe immune response to the medication.
Okay.
I think I've heard that once in 14 years of injecting. When we're using larger doses for medical indications, that risk is going to go up.
Okay.
But really, that's it. So, it's a purified protein. People ask, well, isn't it botulism? It's not botulism. Botulism is that disease is 7 different serotypes of the Clostridium botulinum toxin. This is one of those serotypes. So somebody who was smarter, way smarter than me, discovered that if you take that one serotype and you purify it and you inject it, it was originally injected for blepharospasm. So for
Right.
the twitchy eye you get
Mhm.
when you don't sleep enough, that it relaxes that. So that's how it originally came about, and the ophthalmologists were using it and realized that people's crow's feet look better.
Right. Right.
So it was a serendipitous finding.
Yeah.
So anyway, have we had any questions? Nobody. Probably because we started early. So
I
nobody
know.
even realized we were going. But anyway, okay. But this is going to be available. You can all month. So usually we keep it at the top of our news feed, and you can go back and watch it. So hopefully you learned a little something about all the different places that you can possibly use neuromodulator, and a little bit about the different neuromodulators that are available.
Yeah, and the nice thing is you don't have to try and figure out what you need. That's what Dr. Weiss and our nurse injector CR are here for.
Yeah.
They'll help you figure out what it is that you need and which neuromodulator is the right one for you.
So we are here for you. And like we talked about before, if you missed it, there's always deals, and Botox Week is coming next month, and there's going to be some amazing deals offered by both Allergan, the manufacturer, as well as here in our office. So, so anyway, if you do comment in our news feed underneath this post, there will be a raffle. So
Absolutely.
Your name will be entered to win 20 units of Jeuveau. So if you haven't tried Jeuveau, I highly recommend it. I really like it. I've used all of these in my face. I like them all. And like we talked about before, Jeuveau is the newest one on the market, which isn't a bad thing. I think that they learned some things about manufacturing process from these other companies and learned how to do it a little bit better. So,
and we've been using it in our office here for almost 2.5 years.
Yeah.
So it's new, but it's like not that new.
And they call it high pure technology. So their manufacturing process is highly purified. So, like I said, if you talk to the company, they'll certainly tell you that their product is superior than all the others. I think they're all great. But if you haven't tried Jeuveau, now's the time to do it. And if you aren't the lucky winner of 20 units, or even if you are, you want additional units, they offer $40 off right now.
Yeah, that's what I was going to say, $40 off right now. So that's not a bad deal.
Yeah. Okay, so hopefully we'll hear from you.
All right, and we'll post it on Facebook. And last month's winner, by the way, was Shelly B. She won a laser genesis treatment. So Shelly, if you haven't called in and booked your appointment, you want to make sure you do that.
Well, I know that she knew about it because I saw her say thank you. So.
Oh, okay, awesome.
And we love Shelly. So anyway, next month, we don't know what we're talking about yet.
No.
So Janet likes to say it's a surprise,
I
which
know,
basically means we haven't decided yet. So if anybody has a
She's
topic.
telling my secrets.
I'm way more transparent than Jay. So yeah, if anyone has a topic that they would like us to talk about, and we haven't been very good about getting special guests lately. We're just like, let's just get a bottle of wine and talk.
We just think we're fun, so we like visiting with all of you. So
yeah, so if there is a topic that you'd like to hear about, and if we happen to know someone special who is an expert in that topic, we are happy to reach out and invite them on our show.
Yeah, absolutely. Okay. So we will see you in the office soon, or we'll see you during National Botox Week, the 15th through the 19th of November. And
one more
on the
thing.
10th.
No, October 28th, we are dressing up for Halloween.
Yeah, that's right.
We, as an office, we are dressing up in jazzercise outfits.
80s
jazzercise. So you've got to come and check us out.
Yeah.
And if you come in costume that day, you will win something. There will be something that we're giving away to people who come in full costume.
Yep. That's on October 28th.
October 28th.
Yep. Yep. Absolutely.
I bought everybody neon fanny packs.
Oh, very cool.
And I got my leg warmers ready to go. So anyway, hopefully you guys will come check us out and have a very happy Halloween.
Yep. Happy Halloween. Bye.